Okay, you're responding to a 64-year-old female patient, code 4, who's not feeling well. Okay?
Okay, sounds good. Okay, so arriving on scene, are we arriving to someone's residence?
Hi guys, you're here for my wife. Thanks so much for coming.
Okay.
I don't know, she's acting really strange.
Okay.
I just got home from work and she's just sort of like looped over onto one side. I don't really know what's going on.
Okay.
A little nervous. I hope you guys can help out.
Okay, are you her husband, sir?
Yes, 100%.
Okay, awesome. Are we able to bring the stretcher into the premises?
Yeah, we're just in the living room. Like we live on the ground floor of the
Ground floor?
apartment.
Okay,
So,
perfect.
yeah.
Okay, so just entering the living room here. I'm looking around. I see one patient. Her husband's here as well. Do I see anything that's blocking our view, blocking our access to patient? Anything that could hurt me and my partner?
No, we just have a carpet here. Just other than that, everything's been moved out of the way for you.
Okay, perfect. Let's go ahead and get our stuff. Okay, so just initial assessment. I think that me and you are okay right now. We don't need any additional resources.
Okay.
We just have our one patient. So looking at my patient, she does look to be slumped over. She's not making eye contact with us. She is breathing, so she does have a pulse. Skin color, what kind of skin color am I seeing?
She just looks a little sweaty to me, I guess. Like
Okay, a
if
little
anything,
diaphoretic.
it's just I'm
Little
super
pale.
nervous because she's not even speaking to me. I don't know what's happening.
Okay, how long ago did you come home from work, sir?
Like I work night shifts, so I just got home right now. It's like 2:30. I haven't seen her since like 4 p.m. yesterday.
You haven't seen her since 4 p.m. Have you talked to her since then?
No. I mean, there was some family that was supposed to be over, but they didn't tell me anything. But that was
Okay.
like around 8 o'clock last night.
Okay.
Yeah, I don't know. Here, let me get out of
Okay.
here.
So we do have a strong radial pulse right now. Okay, so you haven't seen her yesterday since 4,
Yeah, I just haven't seen her.
and you came home to her acting like this.
Yeah, like I mean, we're not in the bedroom right now, so I'm not even like this is the living room, so I'm not even sure
Okay.
if she got like to bed last night.
Okay.
Yeah,
Alright.
because the bed's still made and all that, so I don't know.
Right. Okay. Does she have any medical problems?
She has a couple of things going on. Definitely, she has atrial fibrillation.
Okay.
She's been diagnosed with that for 2 years now. She takes medication for that, but other than that, she has something called CHF. I can't remember what it stands
Okay.
for.
All right. Okay. And she's on medications for all of those, you said?
Yeah, I can grab the medication.
Okay. Yeah. If you could go do that, that would be awesome.
Yeah,
Thank
sure.
you.
No worries.
Okay, hon. Can you tell me what's going on today? No, are you having some trouble speaking? Yeah. Is your head sore? Does your head hurt? Shake your head, yes or no. Can you shake your head? No. Okay. No problem. Let's definitely get a glucose. Does your wife have a history of diabetes?
No, she's very healthy as an individual, but she, other than her little heart issue, I guess, but she takes metformin. So here's the metformin
Okay, perfect,
and
thank you.
Tropilol. We make sure she's on top of her medications all the time.
Okay, good.
Okay, so I have some vitals for you.
Awesome.
So the heart rate is 88, respiratory rate 60,
Okay.
and blood pressure is reading 130 over 78.
Okay.
And her SpO2 is 92.
92. Okay. Let's go ahead and get her started on needle cannula then.
Yeah, needle cannula. 4 liters?
Yeah, let's go ahead and do that.
Sure.
All right, just a little prick on your finger here, okay?
Do you guys know why she's not speaking?
We're just gonna do a couple tests just to see, because it could be a couple different things right now. But once we figure it out, we'll definitely let you know as soon as possible, okay?
Shoot, she's drooling a little bit. Let me just wipe that off.
Okay. Blood sugar's reading at 4.3, so that is definitely not the problem. Okay. I'm gonna go ahead and do a LAMS assessment.
Okay.
Okay. Can you make a nice big smile for me? Nice big grin.
So
Okay,
the
so
left side of her face is drooping,
facial drooping.
drooling as well as she
Okay.
tries to smile.
Okay, can you stick your tongue out? Okay. Alrighty, so I'm gonna hold your hands up here. I want you to keep your hands up, okay? Keep your arms up. Okay.
Full drop on the left.
Full drop on the left, I see. Okay. Alright, I want you to squeeze my hands as tight as you can, okay? Squeeze, squeeze, squeeze.
Tight grip
Right.
with the right arm, nothing on the left.
Nothing on the left. Alright, for your feet here. I want you to press your feet up to the sky, okay? Press your feet up to the sky. Good. Good. And I want you to press your feet down like on a gas pedal. Good.
Nothing on
so
the left still.
there's nothing on the left at all. Full facial droop. So
Okay.
I'm gonna say a LAMS score of 5 at the moment.
Okay, so Brigade Stroke Hospital.
I don't don't think we can stroke bypass her
Okay.
because the last time she was seen normal was yesterday at 4.
Oh, okay.
So
Yeah.
we don't know when the onset of symptoms is.
Okay. Yeah. Makes sense.
Let's just reassess all of her vitals
Sure.
before we get out of here, and we're gonna go to the closest hospital.
Okay.
And I'll go ahead and make a patch when we get her onto the stretcher.
Sure. Okay, so I'll get a second set of vitals right now.
All right, I'll go ahead and talk to your husband.
Sure.
All right.
Hey, what's going on with her?
Yeah, so right now we're thinking that she's having a bit of a stroke.
Okay.
So it's just meaning that there could be a blood clot in her brain that's just cutting off a little bit of the blood flow. So
Yeah.
it's making her act like this. It's giving her those symptoms.
Yeah.
So we're gonna go ahead and bring her to the closest hospital so they can do a scan of her head and do what other tests they need to do and hopefully give her some medications to clear that blockage out.
Yeah.
Does that sound good?
No, yeah, it's just a lot. Just because her doctor did mention that this is a risk with her condition. So
Yeah.
so
sure.
do whatever you need to do, of course.
Okay, awesome.
Okay, so her vitals were pretty much the same. Her oxygen has gone up to 94% with you.
Nasal cannula?
Yeah.
Okay, awesome. Let's leave that for now then.
Sure.
Let's go ahead and get stretcher ready so we can move her to transport. Okay. Alrighty, ready. So we're gonna go ahead and take you to the hospital, okay? So right now we think that you're having a stroke, which means that a little bit of your brain is not getting the correct blood flow that it needs, which is causing some of your symptoms today. So we're gonna take you to the nearest hospital, alright? Does that sound good? Yeah? Okay, awesome. So is it okay if we lift you onto the stretcher today? Is it okay if we lift her onto the stretcher?
Yes, please do.
Okay.
Do whatever you
Lower
need to
the
do.
stretcher.
Yeah, let's lower it a little bit here.
You bring as much as you can.
Yeah, ready? 1, 2, 3.
Good?
Awesome.
Yeah. Sorry, can we get you to hold the stretcher on this side? Can we get you standing on that side here?
Yes, yes.
So let's put the wheels in here.
Yep.
Just like
Get
this.
everything
Yeah,
ready.
if you can just hold it like that, we're just gonna be lifting her onto here.
Okay.
Okay, so I'm just gonna tilt this up a little bit just for comfort. Maybe right here. Let's just get it as close as possible. Perfect. If you just want to hold that steady for us, sir, do you want to disconnect every wires for now, and then we'll leave the oxygen on there. Sure. So that should be okay. Let's pull our chair out a little bit as well, so we have a little bit more room to maneuver everything.
Yeah, go ahead. I'm just gonna grab the oxygen.
All right, let's get you on your chair here. Okay. All right.
Okay. There you go. How do you go on the stretcher? On the other side.
Here, I can hold that if you need.
Sure, that would be awesome, sir. Awesome room here. Okay, we're gonna get behind her?
Yep.
Okay, awesome.
Okay. We're just gonna take a grab.
On your count, Josie.
Hold it.
Take your
Okay.
time.
Good?
Yep.
Okay, lifting on 3. 1, 2, 3. Okay, step, set, down.
Down. Nice. Okay, let's get her locked in here.
Okay.
Alrighty.
Did you want to follow us on the car behind you?
For sure, I'll be there right when you guys arrive.
Okay, awesome.
Perfect.
You still feeling okay here, Riley? Yeah, I know.
Able to hear them.
Let me get the monitor if you want to.
Yeah, let's go ahead and reattach her to the monitor. Are you comfortable sitting like this? Do you want to lay back? Okay.
Okay, so I'm gonna just put them between her legs.
Yeah, let's do it. Okay, so we're gonna go ahead and transport patient to the hospital at the moment. Let's take another set of vitals since we moved her just to make sure everything's still okay, and we'll get going and I'll do a patch.
Okay, sure.
Okay.
All right.
Is she still in AFib? Everything's okay there?
Yeah, AFib. Vitals are still the same as well.
Still the same? Okay. So I'm gonna patch to the nearest hospital. So patching now. This is crew 224 on truck 123. I have a 63-year-old female patient here. She has a Lamb scale of 5. Her heart rate is 89, rest rate 16, O2's at 94%, and we have given her a nasal cannula at 2 right now. Is there any more information that you need from me at this time? No? Okay, we're 10 minutes out. We'll see you then. Bye-bye.
Okay, and we're leaving.
Okay.
See.
Let's go.
Okay.